I'm here with Dr. Rachel Rohde, an orthopedic surgeon for Beaumont Hospital, with something we're going to talk about that may be foreign to you, the whole concept of it. It's first I've heard of it, so don't be embarrassed, but it's called mommy thumb. Can you explain mommy thumb a little bit?
True. The mommy thumb actually is called de Quervain's tenosynovitis. We like to call it mommy thumb because it's very common in new parents, not just mommies, daddies too. And it's a tendonitis that is right at this side of the wrist that becomes very, very aggravated when you do a lot of the new things involved with a new child.
So as working moms might have heard of carpal tunnel syndrome from being at the desk too long, stay-at-home moms can also risk injury, and they might not even realize what is it that would cause mommy thumb.
You know, it's putting a lot of stress, a lot of use of the thumb and the wrist in ways that it's not used to being used. So all those little snaps, those little buckles when you get a newborn, the changing the diapers, all those little fine tasks where you're putting a lot of stress.
And a lot of motor skills.
Yeah, yeah.
And even lifting the sack of potatoes. Every time the baby's going in the crib and out of the crib, you got this hook thing going on with your thumbs. You might not realize you're putting 12 pounds on the thumbs about 500 times a day.
Absolutely, and then as they get bigger and they're still not walking, we tend to see people when their child is maybe 9 months old, so not quite walking, but heavy enough to do damage.
How does a mom avoid that? Are there some simple things to do to avoid it?
Well, there are. You know, we always want to try to lift with our big muscles, our bicep muscles. We want to try to keep the baby close to us and lift up with the biceps rather than kind of pulling on the child, you know, pulling them from far away. So that's one of the things. You can keep your thumbs in like this and kind of do a scooping of your baby, try to get them up. If it's really bad, sometimes we'll recommend splint use or even a cortisone shot if it gets very bad.
And that's what I was going to ask. If they already experience it and they're watching this video saying, that's me, that's what I have, I didn't realize it. One of the biggest things, if they come in to see an orthopedic surgeon here at Beaumont, splints, and you said maybe cortisone, is there anything else that might be a treatment?
Well, therapy can be helpful, hand therapy, and if everything else fails, there's a surgical procedure that we do to release the tendon and make it not hurt anymore.
Or just call the husband and make him do more lifting, right?
And then we get daddy thumbs.
That's
yes.
right. Daddy thumbs are a problem too. Let me be the first to tell you. Thank you very much, Dr. Rohde. It's just one of the many things they have here to offer inside Beaumont's Children's Hospital, and we're going to continue this tour.